A very good day to Dr. Noli and my beloved classmates. Today, the group EFGH would like to present the seminar of the OMOP, which is titled of Immunohistochemistry. The following is the outline of our presentation, which is the definition of immunohistochemistry, principles of immunohistochemistry, and protocol for immunohistochemistry. So for the definition of immunohistochemistry, IHC, it combines histological, immunological, and biochemical techniques for the identification of specific cellular or antigen tissue components by means of specific antigen-antibody reaction tagged with a specific label. The site of antibody being identified either by direct labeling of the antibody or by using a secondary labeling. For the principle of immunohistochemistry, antigen in tissue sections is being localized by the use of labeled antibodies as specific reagent. Antigen-antibody reactions are visualized by a marker, for example, fluorescent, dye, enzyme, radioactive element, or colloidal. In order to be able to use certain antibodies, samples must be processed or fixed in a very specific manner. Many antibodies only recognize proteins that have been reduced or denatured, while others only detect proteins epitopes. Some of the antibodies can only be used with unfixed frozen tissue as they cannot bind to the other to target epitopes in formalin-fixed paraffin embedded tissue. But however, an antigen retrieval step can be added to reverse the cross-link that result from. So upcoming is the protocol of. Following is the flow chart of IHC staining protocol. The IHC staining procedure covers from sample collection to final visualization and involves 8 steps as shown. Firstly, tissue preparation is collected from subject. The sample collected has to undergo several steps, which are fixation using 10% formalin, dehydration and embedding, and tissue sectioning into 16 sections. Secondly, the tissue specimen will undergo deparaffination. It will be baked, dewaxed, and rehydrated before moving on to the antigen retrieval. Antigen retrieval is performed to expose antigenic sites and allow antibody to bind. Block non-specific background staining using peroxide block and power block that causes unnecessary background saturation. Next, immunostaining is carried out by either the antibody incubation, detection system, or color development. Upcoming step is counter stain to provide contrast to the primary stain. One of the common gold standard stain that we are using in the lab is hematoxylin eosin staining. Finally, after mounting of the specimen onto the glass slide, the slide is ready to be viewed.
So for the step 1, the tissue preparation, which is the tissue fixations, the tissue sample will obtain from the in vivo host biopsy and rapidly put into the fixative or tissue fixations, which is normally the 10% neutral buffer formalin. And the purpose of the tissue fixation is to retain the tissue architecture to prevent degradation of protein as well as to maintain antigenicity of targeted probe. The tissue samples will obtain rapidly to preserve as to prevent the hypoxia, the lysosomal enzymes, and also the purification changes due to the bacterial and mold growth. A length of fixation is important because it's generally range from 6 to 72 hours is acceptable because excessive fixation might cause antigen denaturation and also the masking, and also too little fixation will cause tissue deteriorations. Next, for the dehydration and also the embeddings, the tissue is dehydrated in sequential bath of ethanol and also xylene, which is the clearing step, and then it was infiltrated by the molten paraffins. It is to maintain structural detail by the infiltration with the matrix, which is typically paraffins. Then it was embedded. For the other tissue processing methods, it includes snap freezing, where the tissue is embedded in gel and cut into cryotom after quickly freezing on dry ice to minimize the damage. Then we will have the tissue sectioning. The formalin fixed paraffin embedded, which is the FFPE tissue sections, are sectioned into thin sections of 3 to 7 micrometers using a microtome. This is the most common form of tissue samples used in IHC. So for the step 2, which is the deperonifization and also the rehydrations, the section slides will pick up and put onto the microscope glasses, and the extension of hot plates is done under the 50 degrees. And then next, the heat slide is put over the oven for 60 Celsius. The washer slides for 3 times for 10 minutes each in the xylene first, and then follow each by 100% ethanol, and then with the 95% ethanol for 1 minute, 85% ethanol for 1 minute, and also 75% ethanol by 1 minute. It is required to do so as to deparaffinized and rehydrated the slides by rinsing it for 5 minutes in distilled water in order to start the tissue stainings. Easy dewax solution can also be used in the one-step dewaxing and rehydration reactions. It forms a free-form xylene and xylene substitute will be formed. And the deparaniphinization and also dehydrations are done at room temperatures. Next, for the step 3, which is the antigen retrieval, its function is to unmask antigenic epitopes on the surface of formalin fixed paraffin embedded tissue sections prior to IHC stainings. It is to expose the antigenic sites for antibody to bind. It works by breaking the methylene bridges between the epitopes and also unrelated proteins. This is the illustration to show that the before antigen retrieval and also the after antigen retrievals. So the chemical involved in the tissue fixation create methylene cross-link between antigen and also unrelated proteins. The antibodies is unable to bind to antigen of interest. The antigen retrieval unmasks the antigen by breaking up the cross-link, therefore allowing the antibody to bind the antigen of interest. So there are basically 2 antigen retrieval techniques. The demonstration of many antigens can be significantly improved by the pretreatment with antigen retrieval reagent that breaks the protein cross-link formalin fixation and thereby uncover the hidden antigen sites. So for the PIER, which is the proteolytic induced epitope retrievals, it uses enzyme digestion to break down the formalin cross-linking to expose the antigenic sites for antibody bindings. So if under digestions, will be too little staining because less antigen are exposed, but if over digestions, there will be false positive stainings with a high background level and also tissue damage. So for the disadvantage of the PIER is that it has a low success rate, the risk of destroying both tissue morphology and also the antigen of interest. For the second method, which is the HIER, the heat-induced epitope retrieval, is a much more commonly used method where it applies heat for a varying length of time for the FFPE tissue section in a retrieval solution to retrieve the antigen and also the restore antigenicities. Normally, the timing for 100 slides is less than 30 minutes. And then for the step 4, which is the blocking of the non-specific background staining. The non-specific background staining is caused by the endogenous enzyme activities, which are namely the biotin, the peroxidase, and also the phosphatase. The blocking agent helps to eliminate non-specific background staining by saturating the tissue sections. For example, the background blocking agents include the peroxide block, which includes a 3% hydrogen peroxide. They use at 10 minutes at room temperature and then wash the slides with saline for another 5 minutes and repeat it 3 times in a shaker.
Like, so theoretically speaking, any protein that does not bind to the target antigen can be used for blocking. Hence, proteins such as BSA, which is bovine serum albumin, or casein may also be used to block non-specific antibody binding. And with this, there's no need to match the region to the species of the secondary antibody. Next on, we have biogenics. Biogenics is a universal blocking region. So it provides blocking agent for both non-specific staining and also non-specific antibody binding. Moving on is the crucial part of immunohistochemistry, IHC, which is immunostaining. So, IHC markers specific to the disease condition, which we call antibody specific to antigen, are chosen based on the tissue type and clinical relevance. Hence, clinical information of the antigen, the function, the subcellular localization, and expression profile helps in determining the antibody selection. So, the incubation period, which is what we say to cultivate the process, may vary for different primary antibodies. So, immunostaining, there's two types of antibody that we can use, which is polyclonal and monoclonal. As we can know, poly means multiple and mono means singular. Hence, for monoclonal, this antibody will bind to a single epitope. Epitope means the part of the antigen molecule to which antibody attaches itself. As we can see here, there's only single, and whereas for polyclonal, it recognizes multiple epitopes of the same structures, hence it can bind to multiple at the same time. So there's a monoclonal will provide a high specific assay, whereas polyclonal will be used in assays that require high sensitivity antigen. For moving on, for immunostaining, there's two methods of labeling, which is direct immunoassay and also indirect immunoassay. So for direct method, basically primary body is conjugated, whereas for indirect immunoassay, secondary antibody is conjugated. So in simple words, the primary antibody that binds to the target antigen, this primary antibody that binds to the target antigen is conjugated, which is linked with an enzyme. And for the indirect immunoassay, it requires two steps, which is primary antibody that does not have any enzymes or any conjugated, any labeling. It will first bind to the target antigen, and next secondary antibody, which is conjugated with enzymes of other substances, will bind to the primary antibody. Okay, so you might ask, so what's the difference between why would we want to choose direct or indirect immuno method? So for direct method, it's obviously simple step and will definitely be quicker. However, because it may yield less sensitive results due to little signal amplification. However, for secondary indirect immunoassay, it is sensitive as we are able to carry out signal amplification. And moving on, Okay, moving on. So I will talk about the different enzymes or conjugate that we can use to we can conjugate the antibody with. Usually there's only two. Usually we prefer either fluorescent detection, fluorescent or chromogenic. So fluorescent so in fluorescent detection, a fluorophore will be conjugated to the antibody. So if there's a reaction, you emit light, provided it's stimulated with a light of provided that is stimulated with light. Hence, for fluorescent detection, it is best to do the staining in a darker place. For chromogenic detection, uh, this happens when usually a colorless substrate which is soluble conjugated to the antibody. So when there is a reaction, the enzyme will convert the soluble substrate, the colorless soluble substrate, into a colored precipitate. Usually, for instance, horseradish peroxidase. Okay, moving on. Uh, as just to recap, IHC can be conducted with two methods: direct and indirect. So to recap again, for direct method, there's only a single primary antibody binding to the antigen with a labeling agent. Whereas for indirect method, primary antibody will selectively bind to antigen and the secondary antibody will bind selectively to the primary antibody. So the most common form of indirect immunohistochemistry is avidin biotin complex ABC method. So what is ABC? First of all, avidin and biotin both are proteins. They have strong binding affinity to each other, and each avidin can bind up to 4 biotin. As we can see here, 1, 2, 3, 4. Okay, so when biotin binds to avidin, they form the avidin biotin complex. They are often conjugated with enzymes such as horseradish peroxidase enzyme, and these enzymes in the circle will usually link these avidin complexes together. So as I mentioned earlier, as this is a chromogenic detection, a colorless substrate will then be added into the slide. A colorless substrate will then be added and hence subsequently converted to a brown precipitate by the peroxidase enzyme to mark the target antigen. This will allow the detection of antigen. So that's all from me. I'll pass on the mic to my colleague. Thank you.
Another type is septawidin biotin LSB method. Basically, septawidin biotin complex conjugate with secondary antibody and alpha enzyme. This method is depending on the number of the enzyme to bind to the molecule, while polymer-based method eliminate the limitation. The polymer does not need to bind to the septawidin biotin complexes. Polymer will simultaneously bind to the secondary antibody and enzyme, thus increase signals and sensitivity toward assay. Move on to the color development, which chromogen oxidized by the enzyme and produce color. For example, HRP give brown color while ALP give red color. Then counterstain need to provide contrast to the primary stain. Commonly used is hematoxylin, which stain nucleic acid blue, and eosin stain eosinophilic structure in red, pink, and orange. Next, how to mount a slide. First, apply a single drop of multimedia upon tissue section. Then, hold cover slit at 45 degrees, allowing the drop to spread along the edge. Then let go of the slit and allowing medium to spread slowly. And the final step is viewing. After clearing and mounting, the slide is ready to be viewed under microscope. This is IHT staining result for OSCC. A is for myoepithelial carcinoma. B showing smooth muscle acting strongly, staining the myoepithelial cells. A. Adenocystic carcinoma that showing multiple patterns, and B. CD117 highlight the epithelial cell. This is for our references, and thank you for listening.